Well, good afternoon, everybody. It's a pleasure to be here. I really appreciate the opportunity to spend some time with you talking about the work that we're doing, spearheaded by the Quality Department, but in no way, shape, or form done completely by the Quality Department. We're very fortunate in that we have the leadership of Presbyterian Health Plan, Presbyterian as an enterprise, along with all of you as staff and clinicians that work with us in order to improve the care and services that are provided to our members and your patients. So our quality commitment, it was really important to us as we built our team and as we work with our members and with our provider community that we have these guiding principles and this commitment to those that we work with. And so we're committed to working with our practitioners and our provider partners to improve the quality measures, to partner with the state Medicaid program to support our mutual success. A lot of the work that we do is with our partners at HSD. We have a large portion of our population are those members served through the Centennial Care Program, and my colleague Mary Eden is going to be sharing with you an update on our Centennial Care Program. We commit to our colleagues and our leadership to communicate openly our challenges and opportunities. If we don't identify opportunities for improvement, we can't make initiatives to see improvement. To be very transparent in the work that we do. There's nothing harder than going before your board of directors or your board quality committee and telling them that we're not at the mark where we want to be with our measures, but we're committed to doing that. Because again, if we can't be transparent and we can't talk about it, we can't improve it. We're also committed to meeting or exceeding our current accreditation, regulatory, and contractual requirements. So whether you're talking for us as a health plan, we're accredited by the National Committee for Quality Assurance. Those that might have worked in the hospital setting before will be familiar with JCAHO, Joint Commission. There's also AAAHC. There's a bevy of CMS regulations, and in addition to the Medicare STAR program for CMS, there's also a set of data metrics called PQRS. And so all of those things out there work together to support the care and services that are received by members and patients. And then we always have a commitment to celebrate success. Sometimes in quality, successful endeavors are few and far between, and so when we do have successes, we celebrate those. And all of this works together to ensure that our Presbyterian members and your patients are getting the care and services that are medically necessary for them. We also work really hard to engage with you, our provider community. We know our colleagues in provider network management do a lot of that. We've had an opportunity over the last 6 to 12 months to do more interactions with our provider community as well. So we partner with our PMG partners as well as our community providers. Every year we put in place the identified priority measures that we've talked about. We actually have a very comprehensive 3-year measure improvement plan. Every year we take a look at the new measures that are coming on board, and we take a look at what we're going to do both from a member perspective and a provider perspective. We communicate with our providers via newsletters, emails. I know there are email blasts. Oftentimes our P&M colleagues will do those blasts on our behalf. We have content in a provider manual that gets updated on a regular basis. Clinic visits from P&M, the quality teams. We've got information on our website. There's, of course, you're all familiar with the provider portal. We develop and automate gaps in care reports, and this is really what has helped us to identify the members that need gaps in care, and we share those with our provider community through the HealthX portal. We work with community providers such as Assured Imaging to make sure that we can get services provided to our rural and frontier members. And then we've launched the Provider Quality Incentive Program, which I talked a little bit about earlier, and we're going to give you a little bit more information on that. And then if you're not familiar with the program, if we haven't had one of our quality folks reach out to you and you're interested in having your clinic learn more about the program, I have a few packets of information here, and then I also have contact information that we can share with you. Right now we have over 80 of our contracted practitioner groups that are participating in the program, and they will help us to close thousands and thousands and thousands of service gaps, which is really what it's all about. So our goal is to improve the health of the population we serve. That's what we've been talking about. That's what we're all about. Our provider groups that participate in the PQIP are given a gaps in care report and a scorecard on a quarterly basis, and we work with them. We provide them with a quarterly goal. If they're able to meet this goal, then there are dollars attached by way of an incentive. So they get paid bonus dollars. We provide the bidirectional communication portal via MyPress, the portal, and then we evaluate it based on claims and medical record documentation. So if you aren't familiar with the program, if you think your clinic, if you're a provider in the audience and you think that your clinic would be interested in learning more, I do have, and I just brought 3, I have some packets, but we have additional information that we can provide to you. Ryan Helton is the program manager on my team, and Ryan is spearheading this initiative, and if you connect with us, and I'm going to actually give you Ryan's direct number as well, you'll have mine and Ryan's. Ryan's the go-to guy for the PQIP program, and he's available at 923, hang on, I'm looking, I should have this memorized, 923-5255, Ryan Helton. Otherwise, my contact information is on the last slide, and I confirmed with him that we are still welcoming with open arms additional provider groups that are interested in participating in the program. And what the team would do is they take a look at the number of PHP members that you have, and our primary focus has been on our Medicaid and our Medicare members, because those are the members that need the most assistance in getting care and services. And what Ryan and the team could do is run an analysis for you, identify what your gaps in care report looks like, and identify what the incentive opportunities would be for you. And then it's up to you whether you think that the work that goes into reaching out and getting their patients in for these services, if it's worth your time and money, then you're welcome to participate. So it is a voluntary program, but the more collaborators we have in our provider network, the better we'll all be. I mentioned earlier that we had identified one opportunity for improvement through some medical records medical record review process that we had done earlier this year. And that's for advanced directives. So we identified it, as we call it, an OFI, an opportunity for improvement. And this is an excerpt from the provider manual that talks about the durable power of attorney and advanced directives. And really what the requirement is that a conversation be had, that the conversation be documented, and that should the advanced directive be completed by the patient and or family, that it be housed in the medical record. We believe, from anecdotal experience, from our own experience, not just as employees of the Presbyterian system, but as patients of Press and our community providers, that the conversations around advanced directives are happening much more frequently than is shown in the documentation in the medical records. So as you're out there, if you're a provider, if you're on the support team, the care management team of our providers, pay special attention to the opportunity to document that advanced directive conversation. There are actually copies of the advanced directive form on our website. You can steer your patients to that opportunity. Very, very important, not only from a quality perspective, but also from our perspective, from a quality perspective, but also to the future of our members and our patients. And on behalf of the Quality Department and on behalf of all of Presbyterian Health Plan and our enterprise, a big thank you to all of you for the care and services that you provide our members, your patients.